Hi, I'm Matthew Fox, and I'm a general thoracic surgeon and lung transplant surgeon at U of L Health. I was never the type of kid that wanted to be a doctor when he was young. I always wanted to be a fireman or pilot or scientist. Then I went to college with the idea of becoming an engineer and studied math and science. And when I started working as an engineer, I really missed the human connection, and I decided to pursue medicine at that point. I had the opportunity to work with some physicians and laboratories along the way, and I saw what they did, and I said, I really want to do that. I'm a thoracic surgeon. I specialize in non-cardiac thoracic surgery. So surgery for the lungs, esophagus, chest wall, airway. That includes a lot of cancer surgery as well as benign surgery for the esophagus and airway. And I do lung transplant as well. I am able to offer minimally invasive techniques for resections for about any type of cancer in the chest. And 90% of the cancer operations I do are minimally invasive, meaning the patient can get in and out of the hospital very quickly. The flip side of that is I have a lot of experience in patients with very complex conditions that you often see at some of these larger tertiary centers, and we can take care of those patients here, and so they don't have to leave and travel hundreds of miles and leave their family. I think patients should make their own decisions. So I view myself as more of an educator and counselor, and I like to talk with the patients and explain their options and help them decide on what their own goals are for their health. And then we come up with a plan that best fits them and is tailored to their own lifestyle and personal situation, and then we help them implement it. The second thing is I ask myself, is this what I would want for my family? And I try to make sure my patients receive that level of care. I grew up in Louisville. I remember the history of Jewish Hospital and University Hospital. I went to medical school here, and I've seen how the institutions serve the community. And I think the merger has really allowed us to pool our resources and deliver care in a much more efficient manner with excellent communication amongst providers. And it's really improved the overall outlook of both the system and, more importantly, the care the patients receive. I love the outdoors. I love to ski. I'm kind of an aspiring triathlete. The coronavirus has kind of hampered that a little bit, but I love to bike and run and swim. I'm a dog dad and a girl dad as well, and between those two things, that takes up most of my time.